Welcome everybody, Dr. Tommy Wolf.
I'm Dr. Vanessa Rodriguez.
And today we're going to help you out with that neck pain you're dealing with.
Yeah, so I'm sure some of you are dealing with chronic neck pain that you've had for years. Others maybe just actually had an accident or have had some acute trauma that it's just started a few weeks ago. Well, we're here to talk about both of those things and what you can do now to help it and what might be causing those.
If you just recently have some neck pain, the best thing you could do is ice the problem area.
Right.
And when you ice it, start out with 10 minutes to 15 minutes. 20 minutes would be the top. If you start going more than 20 minutes, that ice actually can be, what's the word I'm looking for?
Counterproductive.
Counterproductive. So 20 minutes is top. Now if it's a more chronic condition, you've been dealing with the neck pain for years, heat is going to be better. It's going to help bring more blood supply to the area, increase the range of motion, loosen up the tissues.
Yeah, and what could be causing that chronic neck pain if you have had it for years are a few reasons. One, you could have had an injury a long time ago that never quite resolved. But what we're seeing now more and more and more, especially in the next generations to come, is what we call, texting syndrome or, social media syndrome, when we're constantly with our phones looking down. Literally our necks are 90-degree angled, shifted forward, and where that causes a problem is it not only strains the muscles in the neck area, but it actually causes our neck curve, which should look like this, to open up and start to reverse. What that does is it pulls, like I said, on the neck muscles, but it also interferes with the nerves coming from the brain down from the spinal cord out to your shoulders, to your arms, to your heart, to your lungs, all very vital organs and very vital systems that just from looking down over years and years of time can have a huge impact on your health.
Some of the things you can do is you can do a posture check for yourself. One of the things we look for is forward head posture. Your ear needs to be above your shoulder. Now, if you have that forward head posture, that's a sign that you've lost the curve in the neck.
Exactly.
But what also that does, it causes that big hump in the back. Because now that you've lost that curve, the integrity of your spine and muscles, they're working harder and they're working differently than they're supposed to. So if you notice that hump coming along, then you need to get your spine checked, get some x-rays, see what it looks like. The good news is when you restore the curve in your neck, that hump will go away.
Yeah, absolutely. And if you've never had your neck evaluated or have never had an x-ray to see what the actual curve in your neck looks like, or maybe you haven't had an answer of why you're getting that neck pain, you can look at our website, www.thenewhealthcc.com. Get in contact with us and we can go through, walk you through what could be causing it, but more importantly, go through an evaluation with you and give you some answers.
Exactly. So I'm Dr. Tommy Wolf.
I'm Dr. Vanessa Rodriguez.
See ya.
Bye.